here. Auscultation triangle. Triangle of auscultation is between trapezius, latus dorsi, and scapula. In medial side of inferior angular scapula. This area is important for listening of movement of air into the lower lobe of the lung. Okay? My lung is infected. Okay? The doctor have to detect which part of the lung is injured. One of the location is lower lobe of the lung. This infection can you detect by auscultation in triangle. This triangle is auscultation triangle. Auscultation triangle is bounded by trapezius, latus dorsi, and scapula. How can you detect this triangle? How can you find this triangle? Medial side of inferior angular scapula. Medial side of inferior angular scapula is location of triangle. Okay? Deep. When we remove it, we can see three muscles. We can see three muscles. This one is vertebral column, okay? This one is vertebral column. When we remove the trapezius, we can see three muscles origin from vertebral column and insert to medial border of the scapula. These muscles from above to below are levator, scapula, rhomboid minor, and rhomboid major. This one major, this one minor, this one levator scapula. Okay. Levator scapula origin from cervical vertebra, upper cervical vertebra. Rhomboid minor origin from lower cervical vertebra. Rhomboid minor origin from upper thoracic. Upper cervical vertebra, lower cervical vertebra, upper thoracic vertebra. Okay? This one levator, scapula. Okay? This one rhomboid minor. And this one, rhomboid major. Okay? All of them are innervated. All of them are innervated by this way, this nerve. This nerve is dorsal because you can see dorsal surface of the scapula. Dorsal scapular nerve. Dorsal scapular nerve. Okay? In this figure you can see this muscle. Levator, rhomboid minor, rhomboid major. In this figure you can see levator scapula insert to superior angle of the scapula. Insert to superior angle of the scapula. Rhomboid minor insert to
the medial border.
Medial scapula at the level of spine.
The root of the spine.
major insert to medial side, medial border of the scapula below the spine. Okay? All of them are innervated by dorsal scapula. What's function of them? Level of the scapula. Elevate scapula or shoulder. Root minor and major. No, yes. Retraction of the scapula or shoulder. Retraction of scapula or shoulder. Okay. This muscle insert to medial border of the scapula. Which surface? Anterior or posterior? Posterior. Surface of medial border. Okay. In this figure, you can see a muscle insert to medial border, but anterior surface. This muscle is serratus anterior. This muscle is serratus anterior. The serratus anterior origin from upper 8 ribs. Upper 8 ribs. Move posteriorly. And insert this muscle. Origin from ribs. Move posteriorly and insert to medial border of scapula, but anterior surface. These muscles insert to posterior surface of medial border, surface anterior, insert to anterior surface of medial border of the scapula. Okay? Anterior surface of medial border of the scapula. The function of this muscle. This figure shows the function of the muscle. Serratus anterior, move scapula anterior. Move scapula anterior. This function is protraction. Okay? Protraction. I want to push a car. Okay? Flexion of shoulder and protraction. This muscle is innervated. The muscle is called serratus anterior. Is innervated by long thoracic nerve. For memorize, serratus anterior is innervated by long thoracic. Okay, stop. Serratus anterior is innervated by long thoracic nerve. The long thoracic nerve is injured in the long thoracic nerve is injured to mastectomy. When the breast is cancerous, okay, and the person don't note here the cancerous cells diffuse in all part of the body. Yes. After it, the breast must be removed. This phenomenon is called mastectomy. Okay? After mastectomy, the long thoracic nerve is injured. And you can see this one. Okay? The person want to protect shoulder, but the scapula move backward because the muscle is paralyzed, because the nerve is cut.
Isn't that a man?
Yes.
It's a man, right?
This one is called ringing of the scapula. Okay? Ringing of the scapula. Ringing of the scapula produced after long thoracic nerve.
It's damaged.
Yes. lateral border of the scapula, and posterior surface of the scapula. Lateral border and posterior surface of the scapula. This muscle is supraspinatus. This one, infraspinatus. Supraspinatus origin from supraspinous fossa. Infraspinatus origin from infraspinous fossa. Both of them move laterally. Supraspinatus muscle move below acromion and insert to greater tubercle. Supraspinatus move laterally below acromion and insert to greater tubercle. Infraspinatus move laterally and insert to greater tubercle. But this one is above shoulder joint. This one is back of the shoulder joint. Behind of the shoulder joint. Okay? Supraspinatus above, infraspinatus back of the shoulder joint. This one is shoulder joint. Okay? This muscle, supraspinatus. This one, infraspinatus. Infraspinatus back of the shoulder joint. For this reason, supraspinatus is a abductor. Abduction. This function is belong to deltoid. This one is belong to trapezius. What's function of the supraspinatus? The supraspinatus is a starter of abduction in 15 degree. This one, supraspinatus. This one, deltoid. This one, trapezius. Three muscles involved to absorption of the shoulder joint. First 15 degree, supraspinatus. At 90 degree, deltoid. After 90 degree, trapezius. Okay? Both of them are innervated by suprascapular nerve. Both of them are innervated by suprascapular nerve. What's function of the infraspinatus? Is back of the shoulder. For this involved this function. What is this?
Lateral rotation.
Lateral rotation. Lateral rotation of the shoulder joint. Lateral rotation of the arm. Lateral rotation of glenohumeral joint. Lateral border of the scapula. Lateral border of the scapula has two muscles. This one and this one. This one is teres minor. This one teres major. So I learned that in upper limb, minors are above, majors are below. Teres minor and teres major. Both of them origin from lateral border of scapula. Teres minor attached to greater tubercle. If you note, the teres minor is like infraspinatus. This one, okay? Both of them attached to greater tubercle. Both of them are back of the shoulder joint. For this reason, the teres minor is a lateral rotator. Is a lateral rotator of the shoulder joint. is a lateral rotator of shoulder joint. This muscle is innervated by axillary nerve. This muscle is innervated by axillary nerve. Teres minor origin from lateral femoral scapula. Insert to tubercle is back of the shoulder joint. For this reason is a lateral rotator of the shoulder joint. And is innervated by axillary nerve. Teres major, origin from lateral border. Move forward, is like, what is this muscle? Is like latissimus dorsi, move forward and attached to medial border of the intertubercular groove. Latissimus dorsi attached to floor of the groove. This one attached to medial border. This one innervated by lower subscapular nerve. Lower subscapular nerve. And function is like latissimus dorsi. What's function of this?
Medial rotation.
Extension, adduction, medial rotation. Extension, adduction, medial rotation. Okay?
Traditional abduction or adduction method. Injury.
Extension.
Circumduction.
This one is abduction and flexion. Is away from the
Traditional injury. Abduction.
This one is extension. This one is extension. Push the water behind of the body. Okay? This one is extension. Upper limb move toward midline, abduction and medial rotation. Okay? What is this? Supra and infra galley. Supra and infra galley tubercle. This muscle, origin from tubercle. This one. What is muscle? No. Infra. Long head of triceps. Triceps from supra. Long head of triceps muscle. Okay. You can see two space. Quadrant space, triangle space. Quadrant space is near to humerus. Triangle is near to scapula. Okay. Quadrant space is bounded by teres minor, humerus, and long head of triceps. Which part of humerus? Surgical neck. Surgical neck. This space contain this nerve. This nerve is axillary nerve. For this reason, this nerve innervate teres minor. The quadrant space contain axillary nerve and posterior, because you can see posterior view. Okay? Posterior circumflex. Yes. Posterior circumflex humeral, because it's near to humerus. Posterior circumflex humeral artery. Fracture of surgical neck is very, very bad, because this nerve is injured and this artery is ruptured. Because both of them is near to surgical neck. This space is quadrangular space. It's bounded by teres minor, major, and surgical. Triangular space is bounded superiorly by teres minor, inferiorly by
Teres major.
laterally by triceps. Okay. This space contains artery. This artery is near to scapula. It's called circumflex. Circumflex scapula. This one is near to humerus, is humeral. This one is near to scapula, is scapula. Circumflex scapula. And finally, we can see this muscle. This one is anterior scap. Okay? Anterior scapula. This one is subscapular muscle. Subscapular muscle origin from subscapular fossa. Move the fibers of this muscle move laterally and insert to lesser tubercle. Insert to lesser tubercle of the humerus. This muscle is innervated by upper and lower subscapular nerve. Upper and lower. Upper and lower subscapular nerve. The function of these muscles, insertion, move toward origin. The function of this muscle, adduction, medial rotation. Adduction, medial rotation. Okay? Which muscle involve this function? This one is flexion, shoulder flexion. Which muscle? Pt3 major and deltoid. This one. Latus dorsi and deltoid. This one. Supraspinal teres, deltoid and trapezius. This one. No. This one. Adduction and medial rotation. The muscles of adduction are the muscles of the medial rotation. Subscapularis, large muscles. Pectoralis, major. Teres, major. And Pt3 major. Teres major. Subscapularis and latissimus dorsi. All muscles are large. This one, adduction. Which muscles? Subscapularis, Pt3 major, teres major, latissimus dorsi. This function, medial rotation. Subscapularis, teres major, latissimus dorsi, and Pt3 major. This function, lateral rotation. Infraspinatus and teres minor. And teres minor. Normally, when we walk, the upper arm is adduct, no adduct, and medial rotation, no lateral rotation. You cannot see a person move here. Okay? It's very good. Okay? Medial rotation and adduction. Because medial rotation and adductor muscles are very large. Which muscles involved to adduction and medial rotation? Dorsi, Pt3 major, teres major, and subscapularis. Okay? For this reason, lateral rotation is very difficult because two muscles involved in this function. Infraspinatus and teres minor. Teres minor is small. Okay. In this figure, you can see head of humerus. Head of humerus is very large, but the Gehlen cavity is very small. For memorize you can see this figure. This one is glenoid cavity. This one head of humerus. For this is the injury of the shoulder joint. For glenohumeral joint is common because head is large, glenoid cavity is small. For compensating of the guard helped me by two methods. One, there is a ring of fibrocartilage. A ring of fibrocartilage is called labrum, is meaning ring. Labrum glenoidal. A ring for glenoid cavity. Okay? This ring increase volume and depth of the cavity. Okay? Other function is these muscles. These muscles are around the shoulder joint and prevent of shoulder joint dislocation. Anteriorly by subscapularis. This muscle attached to lesser tubercle. Superiorly by supraspinatus attached to greater tubercle. Posteriorly by infraspinatus and teres minor. Both of them attached to greater tubercle, but posteriorly. Anterior, superior, posterior surface of the shoulder joint are protected by these muscles. Which surface is weak? Inferior surface is weak. For this reason,